Hi, and welcome to this episode of The Insurance Experts. My name is Mark Lickman. I'm an actuary and a long term care expert, and it's my pleasure to have Perry Welling on the line. Perry is a certified senior advisor. He actually helps families with placement in assisted living facilities. Thanks for joining us today, Perry.
Thanks for having me, Mark. I'm glad to be here.
So, you have a very interesting background. You're kind of a career changer. So, tell us a little bit about kind of where you started in your career.
I sure will. I started my working career in a nursing home in the maintenance department. I would go to change a light bulb, and instead of being gone 5 minutes, as one would assume, I'd be gone half hour, 45 minutes. So during that time there, I grew a real passion for seniors, and it was nice. It's like being in a building full of grandparents. It was really good experience for me. While I was there, I took a correspondence course in locksmithing, so that kind of dates me a little bit.
Mhm.
Uh, I spent 40 years in that industry, security, life safety. I worked as a locksmith, worked for Moser Safe Company in banks doing security. And my last job was we did mostly grocery stores and uh, retail type things. And I was a designed and installed fire alarms and security and things like that.
That's awesome. I really respect what you do because I'm not very handy around the house. And I could just picture how many skills you have built over a 40-year career there. But since
Yeah.
then, you've changed careers. Tell us a little about your business today.
Yeah, so I have been looking for a change. Last year was uneventful. Had two daughters get married and figured there was nothing else going on. And I've been looking for other opportunities. And this one came up, assisted living locators, and it just spoke to me. It just hit all the boxes. It was serving seniors, serving families, and it gave me the sense of making a difference and helping people. And that's something that really kind of makes me tick.
That's awesome. We love to have guests like you on the show. And today in particular, I know there's a lot of thoughts out there about how COVID-19 is affecting long-term care and long-term care facilities. And there's a lot of misconceptions out there. So I wanted to kind of get your perspective on what's actually happening at the ground level. But first of all, kind of what do you do kind of in your day-to-day in terms of helping families find assisted living facilities?
Sure. So we provide a no-cost service to seniors and their families to help them find a good, safe solution to living at home. That might be short-term or long-term, maybe in-home care,
Hmm.
uh, or where we really shine is with assisted living or uh, even the CCRCs, the continuing care type idea. We've had all of the communities, and we are with the client from start to finish. So I like to tease them. I said, "You're stuck with me, so get used to it." Because
Yeah.
we're there for the helping them figure out what's a great fit. We're there on the touring. We're there when they move in to make sure things go well, and then we do well visits to make sure that the community's living up to the expectations, and that way we can nip any problems in the bud is a lot quicker than if we're just not present.
Yeah, and I can kind of relate it to almost like the real estate industry, right? Where you have a real estate agent that's showing you touring different homes. You're doing the same thing for the families when they're trying to help their parents figure out what's the kind of the next home for them if they need more care, for example, in their elder years.
Exactly. That's a great analogy, and usually we're paid by the communities, and they usually have an advertising budget that we're paid through, so it's not something that's kind of tacked on in the background for the client. We really truly are no cost to the client. It's out of the advertising or whatever budget they've set aside. And yeah, we do like to have a one-on-one relationship. You can't really have multiple placement referral agents working with the same person because that gets confusing, and whoever's got the first referral gets paid. And you wouldn't want to have two insurance agents, right?
Exactly. Well, let's talk a little bit about COVID and how it's
Sure.
affecting the facilities in general. So there's nursing facilities, and those typically are skilled, kind of end of life. People are of poorer health. Maybe there's memory issues. Assisted living facilities where it's kind of the middle, where people need help, but maybe not to the level of the nursing homes. And then there's the home health care with people trying to age in place. Where are you seeing COVID impact today? Because we hear a lot about it in the news, but I don't know that it's across the board.
Right. The biggest hit that we've seen in this area has been in the skilled nursing or the long-term care nursing home type facilities. Or yeah, those would be facilities.
Hmm.
The assisted living communities have been, except for memory care, have been pretty good. And a lot of that with the memory care, I mean, you've got people with memory issues and trying to get them to understand social distancing and washing their hands when it's hard for them to remember from 1 minute to the next is a challenge. And then in the skilled nursing, unfortunately, the pay isn't that great. And a lot of times the employees may be in, have multiple jobs. So outside of that community or facility, they're getting exposed and bringing it in. And because of the nature of the people that are in those long-term care type communities or facilities, they're more susceptible to the virus, and it just rips through them quicker. So
Very interesting. So there's a couple of different factors going on. Obviously, people's health plays a big role. So the less healthy they are, the more they're going to be impacted. And, a lot of people obviously are asymptomatic, but when you have health issues or you're older, a greater percentage of people are going to be impacted. Then you mentioned the people that are actually working in the facilities may be exposed more to it if they have multiple jobs, they're lower income, for example. And it's interesting that you said the cognitive too, and that's kind of related to health. It's kind of your whole body health. So I can kind of understand why the nursing homes have been hit harder than the general population or even the other facilities. Are you seeing the same types of impact though, like with the assisted facilities that you work with, or what precautions do they have in place that's giving you comfort there?
yeah, so the better ones and most all of the ones that I've dealt with, they have a good procedure in place. One comes to mind that they shut down probably. They were probably one of the first to shut down at that March 13th, that Friday, that infamous day.
Yeah, Friday 13th. Yeah.
Right, and they didn't start even considering new residents, new move-ins until 2 weeks ago, and they're
Wow.
very, very cautious about who they're going to let in. Uh, all the employees, whether they be subcontractors or even vendors just coming in,
Hmm.
once a week they get a COVID test, and then upon entry they're also being having their temperature scanned.
Hmm.
The
Now, are
other
you
thing,
finding that the facilities tend to be larger and have a lot more people in them, or are they kind of the smaller, almost like communities of five families, that kind of deal?
the five family ones are they're cautious about who they let in, but the larger ones are the ones that are really kind of doing the more of a rigorous type of testing. But the smaller ones, because they are more of a family unit, they haven't really had the same sort of problems as the larger ones because there's not as many people in and out.
I see.
And there was also something that was kind of interesting where the communities I've talked to, the larger ones, they're independent living folks of because of the isolation and whatnot, they're starting to realize that they're needing more care. So they're winding up moving them to assisted living out of independent.
I see.
And just an interesting dynamic because, you have those activities of daily living that they start to notice they just don't have the capability. And that
Hmm.
social isolation is a real problem. We've also seen some families move people out of the larger assisted living into the smaller so that they have the capability of having a socialization, which is, I don't know about you, I'm an introvert, but I really would like to be around people right about now.
Yeah, exactly. And obviously, if you're living in one place with the same people all the time, it's less risk than if people are moving in and out. So that
Right.
makes a lot of sense. So I think that the kind of the instinct for people in times like this with uncertainty or fear is to kind of not take action, but sometimes your family needs help. They need to go to these facilities. And over the next year, we're going to be on guard with the virus. It's going to last a while, so it's important to understand these different facets of what's safe, what's not safe. So really appreciate you joining us today. I mean, everything you're saying makes sense, but we don't hear about the details, the nuances, the fundamentals out there. So thanks for bringing awareness to that today.
Absolutely. Thank you.